Hello, my name is Dr. Michael Wald. Thanks again for joining me for this podcast entitled, Are Your Vitamins Making You Sick? And what we'll be speaking about during the next 10 minutes or so are actually how several nutrients, 10 of them, some of them vitamins and some of them minerals, can be making you sick. So I've been in the holistic healthcare field for over 33 years, and I've seen every single one of these vitamin and mineral problems, each of these toxicity issues that you really need to know about. So to begin with, I'm a doctor of chiropractic. I'm also a board-certified nutritionist and dietitian and sports nutritionist. I provide acupuncture and life coaching to my clients. I also obtained my medical diploma. I graduated medical school, but I do not have a license to practice medicine. And I'm also the author of over 10 books. One of them is a 500-page textbook known as the Anti-Aging Encyclopedia of Laboratory Tests, which I describe the medical and nutritional meanings of over 170 different laboratory tests. So let's get into this important topic, and I'll begin by reminding you that this information is for your education only. It's not meant as a substitute for sound medical or health advice. So if you're interested in knowing if you're hurting yourself with your nutrients, you need to see a qualified healthcare provider that has license and scope of practice to do laboratory tests, because without that, you can never confirm your suspicions as to whether or not certain nutrients might be making you sick. So let's talk about the fact that we need vitamins and we need minerals. Vitamins are called vitamins because they're vital for our health. And vitamins in general, most of them are water soluble, which means your body gets a certain concentration of them and then it excretes the rest in the urine, and that's that. Now, with fat-soluble vitamins, those are a bit different. They stay in the fatty tissues of the body, and they could stay there for years and accumulate and cause all kinds of health problems and even death. So what's important to realize is that we want to emphasize the right dosing and the right lab monitoring for optimum benefits and safety of various nutrients. So let me start with vitamin A. So why could vitamin A be so dangerous? I mean, we need it for so many things, right? Well, there are quite a number of reports to governmental agencies yearly, which are reports of vitamin toxicity from vitamin A. So what vitamin A can do when excessive amounts store itself in the liver in particular is causing liver damage. Too much vitamin A is known to cause birth defects and also vision issues. So what are some of the symptoms of vitamin A toxicity? Headaches, that's a very common one. Also, dry skin can be a sign of too much vitamin A. Bone pain and liver enzyme elevation. That's also very common and easy to check on labs. You just have your doctor check your LFTs, your liver function tests. If they're elevated, they might be from some form of hepatitis. They might be elevated for some medication reasons, and it can be from vitamin A. So if you're taking vitamin A, you always want to monitor your liver function tests. So if you use vitamin A correctly, you can help your vision. You can improve your immune system. And although I said too much vitamin A can cause dry skin, the right amount of vitamin A can actually help your skin repair. And also we need vitamin A for some hormone production, and at the right dose, vitamin A is a strong anti-cancer compound, and all the endocrinologists know this. So I've written here that the ideal form of vitamin A is beta carotene. That's true most of the time. So beta carotene is a nutrient that converts into vitamin A, but it converts 1/6. So whatever amount of beta carotene you're using, 1/6 of that dose will become vitamin A. That may or not be the right dose for you. You'd have to be monitoring your blood levels of vitamin A to know that. So I've listed here the blood detective laboratory test that you want to think about if you're taking vitamin A or you're thinking of taking it. Serum retinol, which is a vitamin A blood test. Retinol is vitamin A. And those liver function tests that I just mentioned. I listed 2 of them here. There's 3 or 4 of them specifically. So depending on the case, you might want to do all 4 of them or just these 2. The next vitamin of consideration, which is extremely popular over the last 10 years, is vitamin D. And I just want to mention, too, that in the 1950s, when people were taking vitamin A and vitamin D routinely, many people did get very sick and got liver inflammation, what's known as a vitamin A hepatitis or vitamin D hepatitis. So the physicians of the time and scientists said we need to stay away from these nutrients. So after decades, we're talking about generations which are now deficient in vitamin A or D when all we needed to do was monitor these vitamins appropriately. And when it comes to vitamin D specifically, there's probably no more important single vitamin out there right now. We know, for example, that if you're deficient in vitamin D, the risk of your all causes of morbidity and mortality exponentially increase. In other words, your risk of death and disability increases the lower your vitamin D level. We also know that if you don't have enough vitamin D, you run the risk of a heart attack, cancers, for example. So why is it dangerous? Well, vitamin D can be dangerous. It is a fat-soluble vitamin, just like vitamin A, so that means it's going to stay in the body a lot longer than water-soluble vitamins, as I mentioned at the beginning of this talk. We know that excess vitamin D can cause your body to build up calcium, so your blood test will show elevated calcium if you're taking too much vitamin D. And too much vitamin D can cause everything from kidney stones to atherosclerosis to calcifications forming not only just in blood vessels, but in brain tissue. It's nasty. Also, too much vitamin D can cause kidney stones, confusion, and I just mentioned vascular calcification or hardening of the arteries. It can also help prevent hardening of the arteries. And it's interesting because just like vitamin A, there's some deficiency symptoms like vision problems, which you'll get from not enough, let's say, vitamin A, and too much vitamin A can help your can hurt your vision. So it helps and hurts. That's called a reverse effect. Same thing with vitamin D. Too much vitamin D increases your risk of heart attack and hardening of arteries, and not enough increases your risk of heart attack and hardening of arteries. There is, so what are the symptoms of toxicity of vitamin D? Nausea, vomiting, confusion, and calcium deposits found in various areas of the body. For example, many women will find that they have calcified breast cysts, which doctors know, certainly oncologists know, can be precursors to breast cancer. Too little or too much vitamin D could cause that. All right? What are the benefits of vitamin D when you use vitamin D correctly? Well, obviously, vitamin D is going to improve bone health. It is a very strong immune modulator, so it helps the immune system, and it's anti-inflammatory. I could not enumerate the number of conditions that vitamin A can help, which is why most doctors now know about vitamin A, no matter what their specialty is. They just don't know how to test it properly or follow up with it, because most physicians only receive about 19 hours of nutrition education in their entire medical education, which is absolutely nothing. And in terms of safe dosing, well, I do provide some doses for each of these nutrients, but sometimes one dose will be the perfect dose for one individual and a toxic dose for another. So don't take these safety doses that I've given here too strictly, okay? And in terms of lab tests, obviously we'd want to know what your vitamin D level is. Most doctors think that you're doing great if on a 30 to 100 scale, your level's 30 or 35 or 40. No, that's not enough. You want it a 70 to 100. That's the sweet spot where we have a much increased longevity potential and less of a chance of developing comorbid health conditions. And whenever we're taking vitamin D, we want to measure our calcium levels because, as I mentioned, too much vitamin D will cause calcium retention. Then there's parathyroid hormone. We want to measure parathyroid hormone because if one's taking vitamin D, then we need to know if the high levels of calcium are from vitamin D toxicity or too much vitamin D, or if they're from another health condition that can result in high calcium, which is what hyperparathyroidism results in, among other things. High calcium could be an excess of parathyroid hormone causing the high calcium. Now, what about iron? So iron deficiency is the most common anemia in the world, but taking too much is particularly bad. So why is too much iron dangerous? Excessive iron promotes oxidative stress and inflammation and damages various tissues, including the liver, the heart, and the kidneys. Now, what are some of the risks of too much iron beyond what I've just mentioned? Well, there's a genetic condition called hemochromatosis, which predisposes an individual to accumulate iron, and then they usually get liver failure, they get heart disease, blindness, and then there is acquired iron accumulation at toxic doses, which is called hemosiderosis. So those are different conditions. Both ultimately have high iron levels involved. Joint pain, diabetes-like symptoms, poor healing, for example, dizziness, heart disease, cancer and autoimmune disease all can be exacerbated in a person taking too much iron. So if you are deficient in iron and you're a man, well, you're not menstruating, so we want to know why you're deficient in iron. It might be your diet is insufficient, or it might be that you have internal or external hemorrhoids, maybe you have gastric ulcers. So the reasons for anemia in a man must be looked at, and of course in a woman as well. But women, if they're in their menstruating age, the most common cause of iron anemia or deficiency is obviously blood loss. So many people take iron on their own and they end up with these toxic levels of iron and they get all these other symptoms and they don't put it together. And again, doctors are not trained in these various side effects, so it just leads to tremendous stress, disease, increased disease potential, and delay to diagnosis. Now, if you use iron correctly, obviously you're going to help with your iron transport because you need iron to make hemoglobin, and hemoglobin attaches to iron and delivers that to cells so they can get oxygenated. So oxygen transport is important, energy production from that usable oxygen, and immunity. If you're deficient in iron, immunity sometimes is deficient. So by correcting the iron deficiency or anemia, you can improve your immunity. But you only take iron if you are deficient in it. Don't take a multivitamin with iron if you're not deficient. You run the risk of a lot of different diseases and symptoms. Now, in terms of lab tests, there's a couple, and I've mentioned 4 of them here. One is called serum ferritin. That's actually a test of iron storage, and that's important because you want to know if your stores are low so you can help fend off iron deficiency. But if your ferritin is too high, hyperferritinemia, as it's called, increases risk of cancer and heart disease, just to name 2 different things. And then there's total iron binding capacity, serum iron, and transferrin saturation. Those are traditional tests used by internists, family doctors, hematologists, nutritionists like myself to look for iron balance or imbalance. Now, what about zinc? Zinc is another very popular nutrient. We only hear good things about it, but why could and how could zinc be dangerous? High doses block copper absorption, which can lead to copper deficiency. And we need copper, for example, for our nervous systems to work well and some other enzymes in the body. And also, if we take too much zinc, strangely enough, we can develop a dysfunctional immune system. Remember, most people think of zinc when they want to improve their immunity, right? You have a cold, you take some zinc, you have a sore throat, you suck on a zinc lozenge, for example, but too much zinc has the reverse effect by lowering one's immunity. So what are some other risks of excess zinc? Well, there's nausea, copper deficiency, and as I mentioned, immune suppression. What are the benefits of zinc if you use it correctly? Well, one is immune health, as I mentioned, wound healing, and DNA repair. So zinc is needed, along with vitamin A and D, actually, to improve the skin in the body and also the covering of the internal organs, like the intestinal tract. So deficiencies of zinc or D or A could cause the intestinal lining not to heal fast enough, so it's going to age faster, become leakier faster, allow toxins from inside the gut to leak outside the gut through the improperly repaired lining of the intestinal tract, which has these tight junctions normally, but with deficiency, it opens up and then toxins can leak out. So what are some of the lab tests for zinc? And I'm only naming some of them here. One is the plasma zinc level. That'll let you know what your zinc levels have been like for about 3 to 5 days. And then there's something called ceruloplasmin, which is a long-term copper storage protein, which is affected adversely if zinc is in excess. And then there's plasma copper, and you're measuring copper to see if your high zinc is causing a copper deficiency. The next nutrient is selenium. So why could selenium, such an important mineral for heart health and anti-cancer effects, be dangerous? Well, number one, the toxic doses here are certainly greater than 400 micrograms or mcgs. Too much selenium can cause brittle nails, also brittle hair, poor skin health, gastrointestinal upset, neurological symptoms, and just frank hair loss. So what are the risks of too much selenium? First of all, a person will have a symptom usually, but not always, of metallic taste in their mouth. So patients have said to me, I feel like I taste metal. So of course we check for heavy metals, but it's important to know this symptom with selenium because it not uncommonly will cause metal tasting in the mouth if you take too much selenium. Fatigue and some serious neurological damage can result with excesses of selenium. So what about if you properly use selenium? Well, we need selenium for an enzyme that converts something called T4 thyroid hormone to T3. T3 is the active thyroid hormone. So if you're deficient in selenium, you might develop hypothyroidism or low thyroid function. Low thyroid function will put weight on a person, could cause poor skin, hair loss, sluggish healing, all sorts of symptoms that are listed under hypothyroidism. In addition, selenium is a very potent antioxidant, particularly when it's taken with its partner, vitamin E. Another important role of selenium relative to immunity is that selenium is required to make an important immune tripeptide known as glutathione. And glutathione is needed in the body to bind to different toxins and convert them from fat-soluble ones, which stay in the body for long periods of time, to water-soluble ones that can be excreted. So what are the laboratory tests for selenium that we might want to think about? Serum selenium, which again will give us about a 3 to 5 day level of selenium. And then there's glutathione peroxidase activity, which is a functional test of selenium. So if a person is using selenium correctly, they should make, so this enzyme test should show normal. And vitamin B6, who would have thought? Why could this possibly be toxic? So high doses above 200 milligrams per day tend to cause sensory nerve damages. And some of the symptoms cause of the sensory nerve damage would be numbness, tingling, and neuropathy, which is nerve pain. And if B6 is the cause of these neurologic symptoms, even when you correct for the B6 toxicity, these problems may not go away. So it's important to prevent this before it starts. If you use B6 correctly, and by the way, there are hundreds of enzymes that require B6, from detoxification to hormone balance, so many that we want to use this correctly. For example, we need B6 to utilize many of the neurotransmitters made in our brain. We also need B6 for immunity and for energy production in the body. So we'd want a plasma vitamin B6 level and something called homocysteine, which is a functional test, because if you're deficient in B6, your homocysteine levels will be very high. But if you're toxic in B6, it may not show at all in the homocysteine, but you may have some of these other symptoms. But the plasma B6 will always be high if you're taking too much B6. So generally speaking, when I'm dealing with a client, particularly when they have an interest in specific nutrients, is we want to first have a conversation about what their health goals are, and then give them a symptom questionnaire so we can identify how some of their symptoms may be related to, various health issues, but also certain vitamin and mineral toxicity issues. Then we put together a plan in terms of tests, what I call blood detective tests, and many of them I've mentioned on each of these slides, to make sure that when a person's taking their nutrients, they get the benefits without the toxic side effects. Thank you so much for joining me for this presentation. My name is Dr. Michael Wald, and I will see you for the next one. Thank you.